Good morning, Chairman Herger and members of the subcommittee. My name is Joel Marks. I have submitted written testimony which I hope will be accepted. I operate Medical Service Company, which is based in Cleveland, Ohio. We provide virtually all types of home medical equipment and services, including oxygen therapy, wheelchairs, and hospital beds. My company was founded by my parents in 1950, and we have grown over the years and are now somewhat larger than the typical provider in our sector. We serve more than 25,000 patients annually through 14 locations in Ohio, Pennsylvania, upstate New York, and West Virginia. My company was awarded several contracts under the bidding program. I am also testifying today as the proud chairman of the board of the American Association for Home Care, which is the primary trade association for providers of home medical equipment. The vast majority of the association's members are small family operations that, like my company, have served seniors and people with disabilities in their communities for many years. Let me cut straight to the heart of the issue. We do not oppose a properly designed competitive bidding program for home medical equipment and Medicare. Let me repeat that. We do not oppose a properly designed competitive bid program for home medical equipment. In fact, we favor a strongly endorse a state-of-the-art auction system that would provide true market-based pricing, save exactly the same amount of Medicare and beneficiary dollars that the current bidding system is projected to save, and corrects the fundamental flaws in the current system. The current system limits Medicare beneficiaries' access to care. It limits choices for consumers, and it will eliminate the nation's existing network of home care providers, which will ultimately result in hardship and added costs for patients. That would be extremely short-sighted, since home care is cost-effective and preferred by patients. The existing Medicare bidding program designed by CMS distorts the marketplace and the intent of Congress. It radically reduces the number of providers, that is, competitors, allowed to serve Medicare patients, thereby creating oligopolies in the marketplace. It is forcing home care providers to reduce supporting services in order to accept manipulated reimbursement rates obtained through a flawed process. These deficiencies have been highlighted numerous times before Congress. More than 240 economists and auction experts, including several Nobel laureates, have told CMS that significant modifications are needed to fix the current bidding program. More than 30 patient advocacy groups believe that the bidding program as structured today is flawed and needs to be changed. I described the flaws in the current bidding program in detail in my written testimony, but let me mention a few of them briefly. The bids are not binding. This is unheard of in any auction system. The pricing calculation uses a median bid rather than a clearing price. And as CMS has testified, half the bidders bid their best price and ended up with a price lower than that. And there has been a troubling lack of transparency at CMS. To fix the fundamental flaws in the bidding program, an alternative market-based pricing program for home medical equipment has been proposed by market auction experts and providers. That proposal, known as the Market Pricing Program, or MPP, would require changes to ensure a sustainable program. These changes are consistent with the original intent of Congress and save the same dollars originally expected. Let me just mention a few key features of the program. It's designed to be budget neutral, and it's now before CBO for scoring. The bids are binding. You stand behind your bid. There's bid bonds, performance guarantees, and this will take only serious bidders will participate and no one will game the system. The bid price is based on the clearing price, not the median price, which conforms with standard auction design. Reimbursement rates in areas would be adjusted based on the auctions conducted in comparable geographic areas. Rural areas that are currently exempted would remain exempt. And finally, bid areas would be smaller than metropolitan statistical areas and more homogeneous. Current bidding areas can encompass up to 3 states with differing laws, regulations, and costs. This ensures fairness to smaller community providers. We strongly urge Congress to pass legislation that would change the current bidding system to a sustainable market pricing program at the earliest legislative opportunity. This will not result in higher costs to Medicare beneficiaries and will fix a flawed program. We hope that Congress will take the advice of auction experts, listen to patient advocacy groups, and work with the affected stakeholders to create a sustainable bidding system that will serve as a model for other parts of Medicare and not serve as a cautionary tale. I thank you and would be pleased to answer any questions the committee may have.